Because I go in order, and the best thing for physical examination, we do a lot of repetitiveness on purpose. If you repeat that process in the same order every time, it one, helps develop your skills, but two, you don't know when you're going to get interrupted, whether it is a phone call, there's an emergency, a nurse comes, pulls you out of the room, needs you out in the hall because one of your employees passed out. You don't know what's going to happen. So, if you repetitively are doing your physical examination in the same order every time, regardless if you're doing the full thing or just the head, again, you're starting with the same thing and you're going the same order. When you come back, you don't have to stress about where was I. You can come back and just say, I'm sorry for the disruption. I apologize for your wait. Can you tell me what the last thing I did? They only have to remember one thing, okay? And then that tells you where to pick up. See how easy that is? And that doesn't matter what specialty or what you're doing. Definitely very important in emergency medicine, which is what I did. So that's where I know that it's extremely important. But no matter what you're doing, then you'll know that you've never missed anything. And when you're documenting, you know that you're not falsifying documentation because you're doing this multiple times a day. There's no way for you to absolutely remember exactly what you're doing. You're going to remember some instances distinctly, but not every one of them, okay? All right. So, that being said, when I get to the eyes, of course, I'll just say, we did this yesterday, fast forward, now we're moving on to the nose, mouth, those kind of things, okay? All right. We have 25 of these today. If I pull one out of my purse. Put one in here so I didn't pass out the one I needed to use for exam. So,
did you ever find that missing otoscope or thumoscope
set? Nobody ended up accidentally putting it in their bag? Okay.
Did you talk to Professor Brooks? Because she had one with her yesterday.
I talked to her. When I talked to you guys yesterday, I asked her up here, and she said, yeah, I think I put it on my desk. And I went up there, not on her desk. Researched her whole office when she was still down here with that guest lecturer. And then I had going concerns thinking maybe I'm overlooking it because I'm freaking out. And she couldn't find it either. And I told Nikki, I even looked in your bags. Sorry, it was me. I didn't move anything. I was looking. And I've looked in every room of this whole program, so I don't know how it just walked away.
Be on the lookout.
Yes, because for $285 and times however many that we bought, that gets expensive if you're having to replace them every year. Okay? All right. So, these aren't as expensive, but I have counted them. And I know. And the only reason we caught that, because we have a couple of them. There's literally 3 checked out to upperclassmen for their rotations. Those are already signed out, and those were numbered. And so I know which numbers were missing. And then we were given 4 brand new sets yesterday. Monica pulled them out of the plastic, and I plugged them in. And we have 3 brand new sets. So it was a brand new.
Oh.
Just walked away. So, anyways. And I labeled mine, this is not right, it's Reggio, just in case, because I'm very, very, very protective of my stuff. Plus I had extra stuff in my kit, so I knew. This is for digging out cerumen. You're not going to do that. We're not doing that today. Plus I had Q-tips. The thing of it is the reason I put these in here, one, I use them at home a lot when I'm doing this and that. But also, when you're learning how to place that speculum in the ear, as well as that speculum in the nose, put a Q-tip in your ear and kind of push forward and back and up and down. And that way you will learn where the sensitive areas are to kind of stay away, and that'll help you to place that speculum correctly. Same thing with the nose. The nasal septum is very, very sensitive. So of course you're not going to want to put that in there and then turn it into the nasal septum. But the ala is not tender at all. So you can literally put it in there and pull it out, and you're not going to hurt at all. No, it's gross. We're all medical. You're going to have to get over the grossness. So that'll help you too, because if you're just daintily going in there, one, you're not going to be able to see. Two, if they've got a foreign object, you're never going to get it if you're not being aggressive enough to go after it. then they're going to have to go to a specialist, and it's going to be more expensive, more time-consuming, so on and so forth, more stressful to the child, which is usually the case of what has the foreign object in its nose, ear, whatever, okay? So, you will learn through time and practice that you will get more aggressive and be more successful, but I'm trying to give you those key things that I wasn't taught in the beginning for you to kind of get a little bit of a head start. So use that Q-tip to kind of see yourself where those sensitive areas are. There's a nerve of Allen that gets set off too if you put it too deep that makes them cough. Okay, so if you do that a lot, then just know to yourself, I'm going too deep. There we go. Okay, so we're going to go head to toe here. And again, like I said yesterday, the first thing and mostly that you do is observation. I'm going to have you stand sideways because again, that way my back is not here so they can hear me. And that way they can see what I'm looking at and those kinds of things too. So, initially, I've already talked to her, done the whole HPI, getting all of her history. This is a full physical examination for her well woman check. I'm just once a year, not the whole thing. We're stopping. Yeah. She was like, ah.
I don't get paid enough for that.
So, once a year, you should really fill your patient up. Okay, so just let them know. I'm really going to feel everywhere so that I make sure that there's not any tender areas that have been bothering you that you've forgotten to tell me about, so on and so forth. But if there's an area or something that you don't want me to be really intimate with, please let me know ahead of time, or if I'm making you uncomfortable, stop me at any point in time. And I'm talking to my patient now, okay? Same what I just said. Ditto. All right. So I'm also going to verbalize what I'm looking at, and this is how you will do it for your test. Again, I can't read your mind, and whoever's testing or grading you can't read your mind either, so verbalize it. So the very first thing that I'm doing is watching asymmetry. So I'm looking at the shape of her head, I'm looking at the shape of her face, I'm looking at every item on her face. So her eyes, her nose, her mouth, making sure that it's not crooked, it's not drooping on one side, that her eyes are equal, straight across. And she's like, oh, she's looking at me. And then I'm also, you know, you've got to be back far enough and really be mindful of what I'm looking at. I'm going to look straight on, looking at her nose and making sure that her ears, tops of her ears are lined up with her eyes, and one eye's not lower than the other, the pupils, everything. And you'll get so quick at this that you won't realize that you're doing it all, but you need to verbalize it. So,
And you kind of do this while you're even getting your history.
yes.
To be honest.
So when they're talking to you, if they slurred their speech or they're kind of doing this when they're talking, those kinds of things are very noticeable. And you'll find yourself, as you are learning as a student, going to the restaurant and looking at people and starting to try and pick out these things. So it's kind of fun. All right, so now I'm going to go ahead and touch you. You let me know if you're hurting anywhere. And literally be mindful. Teach your fingers to see. That's going to be the very important skill that you develop in time. And everybody's head is shaped differently, but it should be essentially the same as the other side of your head. Kind of like reading an MRI, which you'll learn later. It should look like the other side. Same thing with feeling. I don't see any asymmetry. I don't feel any lesions. I'm going to go ahead and palpate her sinuses as well. Any tenderness here or right in here? Okay. All right, so if you will open your mouth, and since I'm right here, I'm going to go ahead and check. Yes, she already did it, but you'll tell them because they're not going to know. Open your mouth up and down, and then when your mouth is open, if you'll move your chin side to side. Does that hurt when you do that? Because that's the key. You're going to feel some popping. You may have a little bit of crepitus. Normal, a little bit of TMJ possibly, but if they're having pain, that's when you need to refer them on. The other thing would be if they're popping a lot, then you need to ask, have you ever had your jaw lock up on you? That would be important too. All right, so we've done the head essentially. I don't see any asymmetry. You've never had any head trauma, so I don't suspect to see any of that. Her facial symmetry is appropriate. I don't see any lesions. The color is appropriate as well. And then we're moving on. So that's the head for inspection, and then we did the TMJ. Then we're going to move, of course, at this point, I would have done the eyes. Now we're skipping that point, and I go to the nose and the mouth, and then I go to the ears, but it's whatever you prefer.
You'll find your own routine.
You'll find your, yeah, I just kind of go. All right, so you will still need your otoscope, and I've already palpated her sinuses, so the next thing, of course, would be to transilluminate. I always, and you'll see it, I've actually watched YouTube, hold my otoscope like a pen, because you've done that for years, and that's where your motor skills, your fine-tuned motor skills have already been developed. And so if you do it like this, one, you've got the finger to put on their head, and that way if they jerk around or move, then this is moving with them, and it's not going in their ear canal when they move towards you or jumped, because you've hit that nerve of Allen. So I always use your dominant hand for both ears. There's no rhyme or reason why you should have to change. The only time I use this hand is when I'm going after a foreign body, because I want my dominant hand going after. But usually I have somebody else holding it, so that's really out of play. Again, so to transilluminate, you're going to use the no speculum cover, and for frontal, I'm going to place it right underneath. So I'm going to put, and I touch them. I'm going to touch you, and I'm going to show you where I'm going to put this light. It's going to be right here. You're not going to feel pain. I'm just going to see the light, and then I'm going to have you open your mouth, and I'm going to put it here as well, okay? And so you do this, and really the lights are out, and you should cover this part here, and you'll see it transilluminate up. It's light in here, so it's really, really hard to see that. And then again, you place it here, open your mouth. You can kind of see it lighten up here, and it's really, really hard to see it lightening up. We're all in the wrong direction. They're like wow, there's something. You guys have an extra light.
Emergency light.
I don't think you can.
You come over here.
Are y'all angels or what?
I think there's light from there. Right here. All right, so let's see.
You want to see light.
See it? And now open. See how it's lit up, more so on the top of her face than on the inside, but I can see a little bit going through there. Let me do this side and see if it's covering with you standing in front of their direction there. This one doesn't light up as much. Again, their sinuses should be pretty equivalent to themselves, but everybody's sinuses are different sizes. So it's just one, you want to know if they're symptomatic. I can see it inside her mouth, but I had to get my head in your way. Sorry.
She'll show you later.
All right. So that was the sinuses. We did the palpation and then the transillumination. And then we're going to go into the nose. Brought some of these. So again, I've already looked at the symmetry of her nose. She doesn't have any deformities, any abnormalities there. Are you having any pain? And you're just really feeling for cartilage abnormalities there. And I don't feel anything foreign body or bulging masses or anything. If you could sniff and sniff the other side. Good. Feel like you can breathe pretty good either way. All right. And then I'm just going to tilt like a pig. This way. Thank you. Pig nose. And look in there. This is the easiest, best way for me to check her nasal septum. Okay. That way this is not in there touching it. You really don't want to be looking in that direction. And usually if they do have a septal perforation, it is more towards the anterior portion, because that's where most of it is getting hit into the nasal septum when you're sniffing it.
Can you see it pretty easily if they have one?
Usually, yes, it's very obvious. Yeah. Then, again, I use my pinky so that I'm not, I can move with them, and then I go to the outside, and then I tilt. See how I tilted the instrument once I was on the outside? And I just grab your nose while I look away. Don't look away from your finger. And so your head is going to have to be in your view out of the way. So you put it in, go to the side, and then tilt this way, and then my head has to be in there to see in the tunnel. Okay? But I am out of your way, so I'm not doing the correct technique. Same thing, whoops, sorry. And then again, down. So what you're looking at are the nasal turbinates. They seem to be of normal appearance, no enlargement, no erythema, and no pallor. And you can even tilt her nose up to see a little bit more. And you can actually sometimes even look inside if you see something suspicious to get a magnified view. Okay, so that would be the nasal examination. Plug one side of your nose and close your eyes.
This is testing smell.
We're testing her olfactory. What do you smell? Ah. Woo! I was like, I can smell it back here, and it's really, really strong.
It's so bad.
Nope, you're wrong.
I
To the
am.
other side.
I'm kind of coming on cold.
To the other side.
Alcohol or ammonia or something?
It's fingernail polish removal.
Oh, yeah.
Yeah, it's the tongue.
Because we always do that.
I know, now it makes sense, yes. I can smell it, I just couldn't identify.
She forgot all that.
That's right.
Okay, so that's the nose. We've got nares, nasal patency, and then we've done the sinuses. So I didn't see abnormalities in the symmetry of her nose. I didn't see any abnormal lesions, both externally or internally. Her nasal turbinates appeared to be of normal, or I'm sorry, I can't use normal, of appropriate appearance, not boggy, meaning edematous, non-pallor, and non-erythematous, and I did not note any pus within the nasal passage. Okay, so then we can go to the mouth. I do switch hands for it so that I can use this, because you sometimes have even adults that have a tongue that won't move out of your way, no matter how hard they try to relax. So I'm going to use the tongue depressor. I'm not going to gag you. I'm just going to use it to move the structures around.
Yeah, if you do have to use it on the tongue, one thing I had in there but I forgot to mention is it's kind of beneficial if you can rub it or put it under some water or warm water. That helps to reduce the gag reflex. So.
But it also sometimes will stick to their tongue.
Oh, yeah.
It's dry.
I don't. Yeah.
So what you're using the tongue blade for initially is just to kind of move the buccal mucosa around, as well as lowering her lips. Or you could use gloves, obviously. So it's whichever you're most comfortable with. I've seen people grab like a 4x4 and grab their lower lip or upper. And I've also had patients or practitioners say, do you mind grabbing your lip and pulling it down? You know, so on and so forth. So it depends on how you're reading your patient. If it's going to be fun for a child to do it for you and less aggressive for them to be scared, it might be good for them to do it for you as well. Okay, so the first thing I'm going to do, if you go ahead and open your mouth, I'm just going to visualize in there. Stick your tongue way out for me, all the way out. I want to know that her tongue is protruding midline. It's not deviating one side or the other, and that she's able to protrude it. Now you can put it back in your mouth and relax and just open as wide as you can. So I'm checking. She knows how to open and pull up the top of her soft palate. That helps, but a lot of people don't know how to do that. Okay. So as you do that, if their tongue is still in the way and you're not able to see that soft palate, then you're literally going to go in midline and just push down. You don't have to go all the way back.